Hi, I'm Dr. David Greene with PreferredPainCenter.com, where we bring you anything and everything education for pain management. The topic today is what to do when your back goes out. I say goes out. I should put that in parentheses because basically it's the same end result. Your back feels like it's on fire. You may or may not have pain that radiates down into your legs, and it's a very uncomfortable, disabling type of feeling. A lot of people have trouble just getting out of bed, much less walking to the bathroom. Okay? So, what should you do about that? Well, first thing is, don't panic. I mean, millions of people this happens to every year. Over 90% of Americans will have back pain at some point in life. Okay? 9 out of 10. Now, over 90% of those, the pain will go away within 6 to 12 weeks. And it doesn't matter whether or not treatment is received. Do you want to wait 6 to 12 weeks for your pain to go away? There are things you can do to help make it go away sooner. Okay? Now, let's talk about sort of the trend of treatments that are available. But before that, let's look at why does your back go out? Well, it may be that you have a disc herniation. And people call that in colloquial terms a slip disc. Okay? If this is your disc and it looks like a round sphere, all right, you may be getting a tear in the outer part of that disc. And it might be big enough to where some of the inner part squeezes out. And that's called a disc herniation or a slip disc. If you have tears in the outer part of the disc, but no disc herniation, it still can cause back pain because it starts to irritate the little nerve endings that are on the outer part of the disc. If that happens, it can cause spasm in your back and it can cause your back to go out. Okay? Now, it may be that you injured yourself in a sporting event, you could have a muscle strain or a ligament sprain. Okay? Any or all of those can cause muscle spasms and a ridiculously hard time getting out of bed, much less going to work, trying to concentrate with the pain that's spasming in your back. All right? So first and foremost, over-the-counter medications such as Tylenol and anti-inflammatories like Motrin can be very effective. You know, I know you hear it all the time, but I'd be remiss if I didn't mention it because they can work really, really well. Now, the next step would be to talk to your primary care doctor or come and see a pain management doctor, such as an Arizona pain specialist, where they can do higher level medication, such as muscle relaxers or narcotic medication on a short-term basis. Those can be very effective. Okay? So those can help sort of put things at rest, along with potentially a spinal brace, a low back brace. Now, you don't want to wear a low back brace for months and months at a time. But for a few days to a couple of weeks, it can work really, really well. Because it can help immobilize that area, just like if you had a broken arm, a splint or a cast can help it, immobilize it. Same type of thing, okay? You just don't want to wear it long term. You also don't want to take narcotics long term. What happens is the risks of those treatments start to outweigh any of the benefits that are seen. You know, you got an addiction risk, tolerance thing, you need more and more medication. It's better to just take those short term, let the pain get under control, and then go off of those types of things. Here's some additional treatments on the spectrum. Chiropractic treatment. It can be very effective for someone whose back has gone out. Okay? It doesn't have to just be manipulations. It could also include acupuncture or just a regular acupuncturist. That can help with decreasing spasms and pain. Spinal decompression therapy can be very effective for someone whose back is in spasm. Okay? Another thing that can be very effective is a TENS unit. A TENS unit is a device about the size of an iPod. It's battery powered. It can go right on your belt. You can walk around with it. And it attaches little foam pads with wires to your back. And it emits a slight electrical impulse, and it can decrease muscle spasm and also change the way that your brain perceives pain signals. So the pain can come way down. Okay? So you have your bracing, you have your chiropractic physical therapy. Some of that overlaps with chiropractic treatment because you can do electrical stimulation, stretching, strengthening, ultrasound, ice, heat. All those types of things can help put the pain in abeyance. And if you do that, every day or a few times a week, it can really keep it at bay and help you get out of pain faster. Okay? Now, when you start talking about additional pain management treatments, you got the medications and the bracing, TENS unit. Trigger point injections can be very effective. It can help decrease muscle spasms and make things much more tolerable. In addition, there's also the possibility for facet blocks, maybe epidural injections, other types of things that pain doctors can do to make the pain go way down, allow you to do the therapy and the chiropractic treatment, tolerate that, and get out of pain much faster than 6 to 12 weeks. You can bring it back to 1 to 2 weeks, maybe 3, but you get the drift. Okay? So there's an overview of the types of things that are available. If your back goes out, I should say when your back goes out, because 9 out of 10 people has that happen to them. And if you get treatment sooner, you can get the pain away and help it from becoming chronic. There's a small percentage where it does become chronic, 5–10%. All right, check out our site at preferredpaincenter.com. A lot of information on degenerative disc disease, back pain, injections, all types of treatments that are available, and there's videos as well. One number scheduling for Arizona pain specialists. They take almost every insurance you can think of: personal injury, workers' compensation, Medicare, most of the Medicaid, and major insurance plans. In addition, they have multiple locations around the valley. So there's bound to be one close to you. All right, one number scheduling, 602-507-6550. I'm Dr. David Greene, preferredpaincenter.com. Your pain stops here.